गुड इवनिंग टू ऑल ऑफ यू। आप सभी को नर्सिंग विद विनोद सर यूट्यूब चैनल में स्वागत है। टुडे वी आर हैविंग द प्रोबेबल मल्टीपल चॉइस क्वेश्चन विद एक्सप्लेनेशन। I will discuss about the Day-6 which is very important for the forthcoming nursing officer recruitment examination followed by the Odisha SSSC nursing officer recruitment examination. Okay, so let's come back to the today's session. So before starting of today's session you must have to take care yourself against pandemic COVID-19. किसी भी काम में अगर आप अपना 100% देंगे तो आप सफल हो जाएंगे. Just you have to keep in your mind. Okay. So let's come back to the today's important question. Gray baby syndrome is an adverse effect of A option में Doxycycline, B options Tetracycline, C option Gentamycin, D option Chloramphenicol. So put your right response in the chat box. Due to side effect of which drug that will cause the gray baby syndrome during the time of pregnancy. During the time of pregnancy. So you must have to remember this one. Okay, what might be the right answer of this question? I am waiting for your response. Very good. Okay, Mona Lisa given the right response here. That is the Chloramphenicol. Very good. Tuleshwari also given the right response. That is Chloramphenicol. Okay. Chloramphenicol, you must have to remember, this is given to the typhoid fever. This is given to the typhoid fever or drug of choice for typhoid fever. Now it is not given. Typhoid fever is also called as enteric fever. Typhoid fever is also called as enteric fever. Okay. In case of normal individual, it will cause aplastic anemia. The serious side effect of Chloramphenicol is aplastic anemia. So you must have to remember this one. You must have to remember this one. Aplastic anemia. Very good. Okay, all have given the right response. Srushikesh, okay. Josovanti, Tanmayi, all are putting right response. Now we'll come back to next question. Most welcome and very good evening, dear. Okay. Now we'll come back to next question. A patient can become toxic on a normal dose of digitalis when Day-6 is present. Okay, there are 4 options has given to you. Out of that, which option is present in the patient? Suppose at the same time you are giving normal dose to that patient of digitally, then that will be toxic for him or her. Okay, suppose a patient came to the casualty, okay, having which condition? At the same time, suppose we will give the normal dose of digitalis, then that will be toxic for him or her. A option में hyperkalemia, B option में hypertension, C option hypokalemia, D option hypotension. So put your right response in the chat box. What might be the right answer of this question? Those who have not liked the video, like and share with your friend, because the needy or the beneficiary will get the benefit from this Nursing with Vinod Sir YouTube channel. So here, what might be the right answer? Always remember, if a patient is hypokalemia, so you should not give digitalis because normal dose of digitalis also can be toxic for hypokalemia patient. So answer would be the C option. Answer would be the C option. Have you got it? You must have to remember this one. Okay. Now we'll come back to next question. The rate of drug absorption is greatest in the where in which part of our body will have much more greatest affinity of drug absorption. Okay. Whether it will be the large intestine, whether it will be the stomach, whether it will be the gallbladder, and whether it will be the small intestine. So which part of our body will have much more or greatest absorption, drug absorption? So what will be the right answer here? Always remember ADME, okay, ADME, okay, A for drug absorption, D for distribution, M for metabolism, E for excretion. In this way the drug will act in our body. Okay, so you have to remember this one. So what would be the right answer? Very good. Okay, those who are putting D option, very good. Santoshini, Josovanti, Ayushman, Hrudanand, Anita, Hrusikesh, Saira, very good. Okay. Mona Lisa, Josovanti. Very good. Those who have given D option, their answer is correct one. Okay. Small intestine, the rate of drug absorption is greatest in the small intestine. Always you have to remember this one. Have you got it? Now we'll come back to next question. Which of the following drug is used to prevent blood clotting during haemodialysis? Okay, as you know, there are two kinds of dialysis is performed. One is the hemodialysis, another one is the peritoneal dialysis. Okay. Okay, how many types of dialysis you will see? One is the hemodialysis, another one the peritoneal dialysis. So during the time of hemolysis of the blood, okay, to prevent blood clotting, what kind of drug will be given? Whether it be the Coumadin, whether it be the Heparin, whether it is the Protamine sulphate, whether it is the Warfarin. So put your right answer of this question. Put your right answer of this question. So what might be the right answer here? Very good. Okay, those who are putting B option. Okay, heparin, of course their answer is correct one. Very good. You must have to remember this one. Okay, very good. You must have to remember this one. Another important thing, the antidote of, okay, antidote of heparin toxicity. Heparin toxicity. Okay, heparin toxicity, what kind of drug will be given? Protamine sulphate. Okay, you must have to remember this one. Protamine sulphate. You all have to remember this. Okay, if someone will ask you antidote of warfarin, antidote of warfarin, so what will be your answer? Antidote of warfarin. What will be the right answer here? You all have to remember this one. You all have to remember. Mean antidote of warfarin poison means vitamin K. Okay, here that vitamin K. You all have to remember this. Very good. Those who are putting, okay, B answer, of course their answer is correct one. Now we'll come back to next question. A client receiving morphine sulphate should be observed for respiratory depression, blood dyscrasias, C option gastritis, D option jaundice. So what would be the right answer of this question? If someone is taking that morphine sulphate, okay, it is your duty to observe him or her. Okay, so put your right answer in the chat box. Put your right answer in the chat box. You all have to remember here. You all have to remember here. Okay, always you have to remember which one. Answer would be the A. Very good. Kavita, Mona Lisa, okay, Anita, all are putting right answer. That is the respiratory depression. You must have to remember this. Okay, you must have to remember this one. Have you got it? Very good. Okay, Pushpalata, okay, very good. Mona Lisa, Asmita, Pushalata, Smita, Josavanti, Ruku, Panchami, okay, Tanmay, Rinabala, Pispi, Ayushman, okay, all are putting right answer. MK, AVL also. Now we'll come back to next question. Which of the following drugs is used in the treatment of alcohol dependence? Okay, for alcohol dependence, what kind of drugs you will give? Whether the Disulfiram, whether the Lithium, whether Carbamazepine, whether the Verapamil. So which drugs will be given? Put your right response in the chat box. Drug for alcohol dependence. Alcohol dependence. So what kind of drugs you will give? Always you have to remember here. Always alcohol dependence is also called alcohol use disorder. Always iska mean you will get more than a numbers of answer of this question. Also known as alcoholism. Okay, alcoholism. Okay, then what you will tell? Alcohol addiction you will say. Alcohol addiction. Okay, meaning is same. What you are telling that is, suppose you are telling alcohol dependence, that means you are telling about the alcoholism. You are telling about also alcohol addiction. You can also tell, okay, alcoholism. You can also tell alcoholism. Okay, you must have to remember this one. Okay, you must have to remember this. Have you got it? So what drugs will be given? Okay, those who are putting A option, Disulfiram, their answer is correct one. Their answer is correct one. Very good. Okay, all are putting right response. Okay, रितेश, सुप्रभा, ओके, उसके बाद खादिजा, रमेश, वेरी गुड, जसवंती, रीनावाला, स्नेहांजलि, ओके, गीतांजलि, वेरी गुड, हृदानंद, मोनालिसा, पंचमी, okay, all are putting right. Ayushman also putting right answer. Now we'll come back to next question. Thickening of arterial walls due to cholesterol. Each call A option में A options you are getting arthritis, B option aneurysm, C option atherosclerosis, D option none of the above. Thickening of the arterial wall. Thickening of the arterial wall. So what you will tell here? Thickening of the artery wall. Okay, what you will say? Thickening of the walls of the artery due to cholesterol or fat, you can say. Very good. Okay, those who are, so you have to remember here, you must have to remember that is the atherosclerosis. You all have to remember here. That is the atherosclerosis. You must have to remember this one. Okay, very good. All are putting right answer. Now we'll come back to next question. The restoration of body function is known as vocational rehabilitation, primary prevention, social rehabilitation, D option में none of the above. So what you will tell here? What will tell here? Okay, put your right response in the chat box. Very good. In the earlier question, all have given the right response. Okay, now you have to put the right response of this question. Thickening of, okay, the restoration of body function is known as. The restoration of body function is known as vocational rehabilitation, primary prevention, okay, social rehabilitation. D option none of the above. Always you have to remember that is known as vocational rehabilitation. Answer is vocational rehabilitation. Answer would not be the social rehabilitation. Okay, primary prevention. Answer is A option. Have you got it? Well, okay, those who have given A option, their answer is correct one. Now we'll come back to next question. अगर वीडियो को लाइक नहीं किया तो जरूर लाइक करिए. Like the video and share with your friend. Which of the following constitute specific protection? A option immunization, B option avoidance of allergens, C option healthy environment, D option chemoprophylaxis. So put your right response in the chat box. Okay, everyone has to like the video. Okay, don't forget to share with your friend also, because everyone will get the benefit from, okay, nursing with Vinod sir. Here that question is asking about, okay, there are 4 options has given to you. It is your duty to identify the specific protection. Specific protection. So of course that answer will be the immunization. Answer will be the immunization, because you know that, okay, diphtheria, pertussis, tetanus, hepatitis B, okay, Haemophilus influenza B. So the lot of disease you are going through, you are treating a lot. Then as BCG vaccine also you are giving. Okay, you must have to remember this one. You must have to remember this one. Okay, have you got it? So it is also known as specific protection. Mean these due to immunization you are treating the specific diseases. You are treating the specific diseases. All are putting A option. Okay, all have given the right response. Very good. Okay, now we'll come back to next question. Which of the following is tertiary level of prevention? Which of the following is the tertiary level of prevention? Option A, health promotion, B, specific protection, C, early diagnosis and treatment, D option में disability limitation. So put your right response in the chat box. Put your right response in the chat box. I am waiting for your right response. Okay. So you all have known, okay, you all know levels of prevention. Okay, levels of prevention, definitely you will get the one question. Definitely you will get one question from the, okay, levels of prevention. First one is the primordial prevention. You all have to remember this one. I have already taken one video regarding this one. You can watch it and take it note in your note copy. Primordial prevention, primary prevention, okay, secondary prevention, another is the tertiary prevention. So in case of tertiary prevention, okay, so put your right answer in the chat box. Very good. Those who have given, okay, which of the following is tertiary level of prevention? Okay, so you must have to remember the answer will be the D option. Okay, those who have given D option, their answer is correct one. Okay, you all have to remember this. Answer is, this is the answer. Okay. Health promotion is a primary prevention. Health promotion is a primary prevention. Okay, you have to remember this one. Okay, early diagnosis. Okay, early diagnosis and treatment is a secondary prevention. Secondary prevention. Specific protection is also a primary prevention. Okay, so here you are getting two primary prevention. Health promotion is primary prevention. Specific protection is a primary prevention. Early diagnosis and treatment is a secondary prevention. But disability limitation and rehabilitation, that will come under the tertiary levels of prevention. Okay, okay, I know here. Okay, D hoga. Okay, that's why I mentioned here also D answer. D is the right response. Okay. Prophylactic administration of vitamin A in a child is health promotion, treatment, specific protection, D option rehabilitation. D option rehabilitation. Okay. So you all have to remember in the primary prevention, health promotion will be there like education, environmental modification, nutritional intervention, health education, specific protection. Okay, so this will come under the primary levels of prevention. Okay, secondary you are getting early diagnosis, treatment. Okay, another important thing is the national health program, secondary prevention. So you have to remember this one. You must have to remember this one. I have already taken one video regarding this one. So here that answer will be the specific protection. Very good. You all have to remember this one. Very good. All have given the right answer. Very good. Tapas, okay, Mansi, Josovanti, Rinabala, Santoshini, Tanmoyi, Priyadarshani, Hrusikesh, Pushpalata, Snehanjali, Gitanjali, Kavita, Kumareski, Mona Lisa. Okay, all have given the right answer. Now we'll come back to next question. Panchami Sudipta has also given the right answer. Tertiary level of prevention is health promotion, okay, chemoprophylaxis, rehabilitation, early diagnosis and treatment. In the earlier I have already told you, early diagnosis and treatment will come under the secondary levels of prevention. Level of prevention. You have to remember this one. Health promotion, this one is the primary prevention. Primary prevention. Okay, you must have to remember this one. You must to remember this one. Okay, so put your right response in the chat box. Okay, see rehabilitation. In the earlier I have already told you rehabilitation plus, okay, disability limitation. Disability limitation. Disability limitation, that will also come under the, okay, tertiary level of prevention. Very good. Okay, those who have given C option, their answer is correct one. Very good. Josovanti, Tapas, Saira Rani, Priyadarshani, Pushpalata, Kavita, Gitanjali, okay, Pispi, okay, Hrusikesh, Khadija, Rinabala. All have given the right response. Okay. Now we'll come back to next question. Total morbidity determined by. Total morbidity is determined by active surveillance, passive surveillance, sentinel surveillance, annual survey. Okay, you must have to remember this one. Morbidity. What is the meaning of morbidity? Okay, morbidity means sickness rate. Morbidity means sickness rate. And mortality means death rate. You have to remember this. Mortality means, okay, death rate. You all have to remember this one. Okay. So, what kind of, okay, surveillance it is? What kind of surveillance it is? So, put your right response in the chat box. Okay. You must have to remember here. Answer will be the sentinel surveillance. Total morbidity determined by sentinel surveillance. You all have to remember this one. Okay. Now we'll come back to next question. Keeping the frequency of illness within acceptable limit is best described as disease. A option में control, B option में prevention, C option eradication, D option surveillance, E option treatment. Keeping the frequency of illness within acceptable limit. Okay, suppose in a village or in a community, suppose 100 people are there. Okay, 100 people are living there. Okay, suppose okay, COVID-19. Okay, this time is going on COVID-19. Out of that 10 to 15%, they are infected with COVID-19. They are infected with COVID-19. You want to protect the remaining 85 number of person from the COVID-19. Okay, that means you are keeping the frequency of illness within acceptable limit. Is described as disease control. Very good. Mona Lisa, Kumar SK, Kavita, Pusholata, Priyadarshini, Gitanjali, all have given the right answer. That is the A option. That is known as disease control. Mean you have properly controlled the disease. Rusike, Saira Rani, okay, also given the right answer. Okay, now we'll come back to next question, which is not essential in case of cholera epidemic. Okay, 4 option has given to you. Okay, you have to choose one, okay, option which is not essential in case of cholera epidemic. A option में weekly chlorination, B option में notification, C option में vaccination of the individual, D option में treatment with ORS and Tetracycline. Always you have to remember cholera is a what kind of disease, whether it is a waterborne disease, okay, whether it is the airborne disease, okay, whether it is the arthropod-borne disease, okay, you all have to know about cholera is a what kind of, it is a waterborne disease. It is a acute diarrheal illness caused by infection of the intestine with the toxigenic bacterium, that is Vibrio cholerae. It is a Vibrio cholerae. So you have to remember here. Vaccination of the individual is not essential in case of cholera epidemic. Very good. Very good. Priyadarshani, okay, you have given the right response. Okay. Son Josovanti has also given the right answer. You must have to remember this. You must have to remember this one. Now we'll come back to next question. Most common cause of epidemic of infective hepatitis in India is HIV, hepatitis A virus, HHV, SCV. Okay, another is the HIV virus. Okay, which hepatitis is known as infective hepatitis? Okay, which hepatitis is infective? So put your right answer in the chat box. सही आंसर पुट अप करिए. Okay, which hepatitis is most infectious? Okay, infective hepatitis, you must have to highly contagious and can spread from person to person. You must have to remember this one. That answer to be the hepatitis A. Okay, especially you must have to fecal-oral route transmission. Fecal, okay, oral route, okay, route transmission. Okay, route transmission. In the earlier I have already told you, okay, vowels for bowel, you all have to remember this one. Okay, mean vowels matlab A and E. Okay, so out of that, which one will be the right answer here? Okay, those who have given A option, their answer is correct one. Their answer is correct one. You must have to remember here. Okay, you must have to remember here. You all have to remember this. A option. This is the answer. Okay. Now we'll come back to next question. The infectivity of a convalescent case of cholera lasts for. Suppose a person, okay, infected with cholera. How many days? Okay, he or she becomes infectivity. Okay. Suppose someone is infected with any disease. Okay, after the recovering from that disease, that person is also, that period is known as convalescence period. From the recovery up to 7 days, or as per the incubation period of the disease, okay, during that time you are getting a period, that period is known as convalescence period. So less than 7 days, 7 to 14 days, 14 to 21 days, 21 to 28 days. So put your right answer in the chat above. Okay, those who are putting C answer, hepatitis B and hepatitis C, SCB. Okay, epidemic, that question is asking about. Okay, in fact, epidemic, that question is asking about. As you know, Sambalpur, okay, Sambalpur was having, okay, hepatitis A and hepatitis E virus. Okay, much more persons are infected with hepatitis. Okay, A and hepatitis E. Okay, you know that. That is known as epidemic. That is known as epidemic of infective hepatitis. Okay, have you got it? So here what would be the right answer? Here that answer would be the 14 to 21 days. You must have to remember this one. You must to remember this one. Okay, now we'll come back to next question. Disease imported to a country not otherwise present. Okay, I mean that one disease is imported to a country not otherwise present. A ऑप्शन में एक्जोटिक, बी ऑप्शन में एंजोटिक, सी ऑप्शन में एपिजोटिक, डी ऑप्शन में एंडेमिक. So put your right answer in the chat box. What would be the right answer here? Okay, what would be the right answer in the chat box? Okay. Okay, you must have to remember here. Bird flu, influenza, avian influenza. These are the imported disease from the outside country. Bird flu, you can say bird flu. Okay, another one is the sleeping sickness. Sleeping sickness. Okay, chikungunya fever. Okay, or West Nile virus. West Nile virus. Nile virus. Okay, so these are the example of disease imported to a country not otherwise present. That's why it is known as exotic. Okay, that's why it is known as exotic. You must have to remember this one. Another Chagas disease. Another disease is also called a Chagas disease. You all have to remember this one. Another chikungunya fever. This is also a exotic disease. Chikungunya disease, you can say. You all have to remember this one. Okay, have you got it? Answer would be the A option. Now we'll come back to next question. Healthy carriers are found in. Healthy carriers are found in all except A option cholera, B option diphtheria, C option where, D option में okay pertussis. So put your right response in the chat box. What would be the right answer here? Okay, what would be the right answer? You all have to remember here. Okay, healthy carriers are found in all except, okay, except you all have to remember. This one is the typhoid actually. Okay, this one is the typhoid, you can go through. Okay, typhoid. Okay, so here that answer will be the pertussis. Okay, you must have to remember this. Healthy carriers are found in all except typhoid. Except pertussis. Okay, pertussis is also called as whooping cough. Whooping cough you will see. Okay, the coitive organ the whooping cough ni korine. Okay, Bordetella pertussis. Bordetella pertussis. You all have to remember this one. You all have to remember this one. Okay. Now we'll come back to next question. Which is most difficult to block spread of vector man to man airborne and another waterborne? Okay. So put your right response in the chat box. What would be the right answer here? Okay. What would be the right answer here? Okay. So which one is the right answer of this question? Airborne. Okay, as the we people are suffering from that airborne disease, that is the COVID-19. That is the COVID-19. We are going through last 2.5 years. We are suffering from this one. You must have to remember this one. Okay. Very good. Now we'll come back to next question. Which does not have latent infection? As you know that chickenpox, mumps, malaria, smallpox do not have latent infection. Which do not have latent infection? So put your right response in the chat box. I am waiting for your right answer. I am waiting for your right answer. Okay. What is the meaning of latent infection? What is the meaning of latent infection? Infection. Okay. Latent infection is a infection which is hidden. Which is hidden. Inactive, you can say. Inactive or dormant. Okay. Which disease is dormant or inactive or hidden? So put your right response in the chat box. Put your right answer. Okay. As you know, smallpox has already been eradicated from the world. Okay. This is do not have latent infection. If someone will ask you what is the meaning of latent infection? Okay, your answer would be the infection is said to be latent if it is hidden, inactive and dormant. Then that is known as latent infection. Have you got it? Now we'll come back to next question. Secondary attack rate reflects severity, communicability, fatality, and another infectivity. So put your right response in the chat box. If you have not liked the video, like the video and share with your friend. Don't forget to share with your friend. Secondary attack rate reflect severity, communicability, fatality, infectivity. So I am okay. Here that answer would be the communicability. Reflects communicability. You must have to remember this one. You must have to remember this one. Okay. Now we'll come back to next question. All are live vaccine except live attenuated vaccine. Live attenuated vaccine except A option में measles, BCG. Okay. Another the oral polio vaccine. D option hepatitis B. So put your right answer in the chat box. Which vaccines are known as live attenuated vaccine? Which vaccines are known as live attenuated vaccine? Okay. You must have to remember. You must have to remember here. So what would be the right answer of this question? Okay, what would be the right answer? Okay. Put your right response in the chat box. सही आंसर पुट अप करे लाइव attenuated vaccine like measles, okay, mumps, rubella, yellow fever, some influenza vaccine, okay, live attenuated vaccine. So you must have to remember this one. Put your response here. What would be the right answer? Okay, you all have to mean except oral polio vaccine is a live attenuated vaccine, LAV, polio vaccine. You must have to remember this one. Measles, MMR, that is also a live attenuated vaccine. Okay, another one is the, okay, you must have to remember that is the BCG. This is also live attenuated vaccine. Okay, measles is a viral. Okay, this one is the virus. BCG is a bacteria. oral polio vaccine, it is also a viral vaccine. You must have to remember this one. Okay, except hepatitis B. Those who are putting except, here that question is asking about except. ये क्वेश्चन ट्रेंड है, ये ट्रेंड क्वेश्चन है. You don't forget, this one is the trend MCQ. Trend MCQ. Okay, it is going on. It is going on or asking in different nursing officer recruitment examination. Different nursing officer recruitment examination. You all have to remember this one. Hepatitis B. Okay. Now we'll come back to next question. Carrier state is important in following except. Okay, 4 option has given to you. Out of that, okay, I mean in case of 3 options, that carrier state is important except one condition. A option में measles, B option में polio, C option में cholera, D option में typhoid. So put your right answer in the chat box. What would be the right answer here? What would be the right answer here? Okay, you all have to remember. You all have to remember here. What you will remember? Answer would be the measles. Okay, except measles, all are the carrier state is important. Typhoid, someone is having the typhoid that will long lasting for years, okay, month to year also. Okay, cholera is also like that, polio is also like that. So you do, measles is not like that. Okay, answer would be the A option. Incubation period is helpful for all except quarantine, source identification, preventive immunization. D options you are getting isolation. So what would be the right answer? So put your right response in the chat box. You all have to remember here. You all have to remember. Okay, what you will remember? Answer will be the isolation. Incubation is period is helpful for all except isolation. So you have to remember this one. Very good. Mona Lisa given right answer here. Very good. Vertical transmission is by mosquito, direct contact, droplet, placenta. Where that vertical transmission is going on. In which condition vertical transmission is going on? Vertical transmission. So put your right response in the chat box. Put your right response in the chat box. Okay. Vertical transmission means, okay, the disease or transmission of viruses. Okay, transmission of viruses from parents to transmission of viruses from parents to their offspring. Their offspring. Okay. So which one will be the right answer here? Very good. Placenta. Okay, all have given the right response. That answer is the placenta. Okay, placenta is discarded in yellow. Okay, yellow color, yellow plastic bag, plastic नॉन क्लोरीनेटेड बैग में इसको डिस्कार्ड किया जाता है. ओके, क्लोरीनेटेड बैग. इसी ऑल क्वेश्चन ऑफ बायोमेडिकल वेस्ट मैनेजमेंट रूल अकॉर्डिंग टू 2016 गाइडलाइंस. ओके, now we'll come back to next question. The cycle of yellow fever virus in Aedes is propagative, cyclopropagative, cyclodevelopmental. Another one is the any of the above. So put your right response in the chat box. Okay, here I am telling a lot of question propagative. Okay, just wait, I am telling a lot of question here you will get, because this is also very, very important. First we will go to the propagative. Propagative means what? Propagative, an agent undergoes multiplication. Agent undergoes multiplication. Undergoes multiplication. That is known as propagative. Multiplication. Okay, you all have to remember this one. There is no development, no change in form. Example, you can take an example of that. Propagative, plague. Okay, plague bacilli in, okay, in red fleas. In red fleas. You have to remember this one. Now we'll come back to the cyclopropagative. Cyclopropagative basically agent undergoes both development and multiplication. Agent undergoes both development and another one is the multiplication. Multiplication. You have to remember this one. For example, malaria parasite. For example, malaria parasite. You all have to remember this one. Malaria parasite. Okay. Now we'll come back to the cyclodevelopmental. Agent undergoes only development. Okay, agent undergoes only development. Only development. You have to remember this one. Where that only a development it will undergo microfilaria. Microfilaria. Microfilaria in mosquito. In mosquito. So put your right answer in the chat box. Okay, what would be the right answer in the question? You all have to remember that answer with the propagative. Okay, agent undergoes multiplication. You must have to remember here. Okay, have you got it? Now we'll come back to next question. Trans-ovarian transmission of disease include. Trans-ovarian transmission of disease include syphilis, AIDS, KFD, another rubella. KFD is also called as Canasur forest disease. Kaisanur forest disease. Forest disease. Kaisanur forest disease. Okay, so put your right answer in the chat box. Include trans-ovarian transmission of trans-ovarian transmission. Okay, that means transmission of an infectious agent from parent to offspring via infection of the developing egg. Okay, so you must have to remember this one. Trans-ovarian transmissions, you are getting that meaning. Okay. थ्रू ओवारी, ट्रांस ओवारियन का मतलब ओवारी के माध्यम से होगा. Okay, it does not mean the AIDS. I am not asking about that answer. Here not B option. Trans ovarian means through the ovary. Okay, through the ovary. Through the ovaries. Okay, you all have to remember this one. Through ovaries. Okay. Bhopal gas tragedy is an example of slow epidemic, continuous epidemic, point source epidemic, another one the propagated epidemic. Okay, so put your right response in the chat box. What would be the right answer? Okay, what would be the right answer here? Okay. Bhopal gas tragedy. Bhopal gas tragedy. Okay, you all know Bhopal gas tragedy. Okay, okay, that means that is also Bhopal gas disaster. It is also called a Bhopal gas disaster. Okay, or Bhopal disaster. You all have to remember this one. This was happened. Okay, on the night of 2 and 3rd December 1984 at the Union Carbide, okay, of Bhopal. यूनियन कार्बाइड इंडिया लिमिटेड पेस्टिसाइड प्लांट इन भोपाल मध्य प्रदेश. यूनियन कार्बाइड इंडिया लिमिटेड, ओके, पेस्टिसाइड भोपाल MP. You all have to remember this one. So what kind of, okay, what kind of example it is, okay. You all have to remember point source epidemic. Each and point source epidemic. You all have to remember this one. Point source epidemic. You must have to remember this. Okay, have you got it? Bhopal gas tragedy is an example of point source epidemic. Okay, you all have to remember this one. Now we'll come back to next question. The most useful study in a hospital setting is cross-sectional longitudinal cohort case control. What would be the right answer here? Okay, very good evening dear Abraham. Okay, so what would be the right answer here? You all have to remember that answer to be the case control. Answer to be the case control. Now we'll come back to next question. Cancer control program was launched in 1975, 1986, 1970, 1992. So what will be the right answer? Cancer control program CCP was launched in, where it was launched? When did it was launched? So your answer is the 1975. You must have to remember this one. The screening method of choice in prevalence of leprosy is 1 in 1000 is contact survey, group survey, mass survey, any of the survey. So what kind of survey it is? What kind of survey it is? So put your right response in the chat box. Okay, कैंसर कंट्रोल प्रोग्राम लॉन्च हुआ था 1975 को. डोंट बी कंफ्यूज. Here that answer to be the group survey. Answer to be the group survey. That's all for the day. See you tomorrow. Hope you all enjoyed a lot. Thank you very much to all of you. See you tomorrow another interesting session of the day 7 Odisha SSSC nursing officer. Hope you all enjoyed a lot. Take care. Jai Hind, Jai Bharat. Practice makes man perfect. If you are practicing in day-to-day life, definitely you will be succeed. Okay, there is no shortcut method to get the success. Only and only that is hard work. जितना आप पढ़ोगे उतना आप सक्सेस होने का चांसेस बढ़ेगा. Okay, it does not mean that one class will give you all knowledge. I will direct you. Mean what kind of questions are asking in day-to-day life. Okay, if you are contact with that